Hello everyone. Hello everyone and welcome. Welcome to this audio podcast. This audio podcast is part of the ShiZMode Chapter. This audio podcast is part of the shitstorm Panzer. This audio podcast is part of the analysis and expose and lobostics, and this audio podcast as part of the Geronimo, and this audio podcast is part of a Storm Lobostics production. And through this audio podcast, a look at sort of smaller sort of nursing home or care home practices, and as part of works looking at polypharmacy and nephrotoxicity. So individuals living in sort of in care or nursing homes, especially older individuals that require particular forms of care, and consideration, particular forms of care, and also consideration from prescribers. This is sort of reflected in a document that was referred to as a document of as medicines for older people, which had been published a little while ago, and once again, as part of this audio podcast as sort of chapter, then will be a look at the sort of there will be the sort of citations or references as part of this. However, at the same time, this has reflected sort of where it's reflected in around the document by the which was from the document Medicines for Older People, which was sort of conceptualized by the Department of Health some time ago. A component of the document of the National Service Framework for Older People. It also describes how to sort of maximize the advantages of medicines or medicines use, and how to avoid excessive, inappropriate, and or inadequate medicines used by individuals living in amongst care and or nursing home environs. The most important effect is reduced renal clearance. And older individuals excrete drugs sort of more slowly, more slowly, and are highly can be high, and at the same time evidence in amongst the literature has informed or does inform that the nephrotoxic drugs, nephrotoxic medicines in older individuals are excreted more slowly, and where at the same time where older individuals or older patients, for example, or healthcare service users, are at the same time more susceptible in some regard to the nephrotoxic side effects, of those particular drugs under the British National Formulary, for example, under the categories under diuretics, ACE inhibitors, non-steroidal anti-inflammatory drugs or NSAIDs, and particular antibiotics such as gentamicin. So that draws this audio podcast to a close. This audio podcast is part of the ShiZMode Chapter. This audio podcast is part of the analysis and expose and lobostics. This audio podcast is part of the shitstorm Panzer. This audio podcast is part of the Geronimo and a Storm Lobostics production.